Hi, good day everyone. My name is Dr. Alan Basil Peter and I'm a clinical radiologist and medical lecturer at the Faculty of Medicine, UITM. Today I'll be teaching you the basics of musculoskeletal anatomy from a radiological aspect. This is the outline of our lecture. We will be using plain radiographs in our learning today. We will look at the bones of the upper and lower limbs, the joints of the upper and lower limbs, and also the anatomy of the vertebral column. Let us start with the bones and joints of the upper limb. These are radiographs of the right hand in AP and oblique views. This is the AP view and this is the oblique view. When taking radiographs, we always take radiographs in two views to detect pathology, as this gives better delineation when evaluating bones and joints. This is a radiograph of the left hand. As you have learned the anatomy of the bones and joints, now let us look at the radiological anatomy of the left hand. It is comprised of multiple small bones. We have phalanges, which are the proximal, middle, and distal phalanges of the fingers. We have metacarpal bones, which is the first, second, third, fourth, and fifth metacarpal bones, and multiple carpal bones. These carpal bones have been assigned specific names such as the scaphoid, the lunate, the pisiform, the triquetrium, the trapezium, the trapezoid, the capitate, and the hamate bones. Included in these radiographs are also the distal portions of the ulnar bone and the radius. Please take note that the thumb has only a proximal and distal phalanx. It does not have a middle phalanx. Now let us look at the joints. There are numerous joints in the left hand. Here you have the distal interphalangeal joint, the proximal interphalangeal joint, the metacarpophalangeal joint, and the wrist joint. Now let us look at the X-ray of the wrist joint. As mentioned earlier, we always take X-rays in two views. The common views are the AP view of the wrist joint and the lateral view of the wrist joint. Here we study the alignment of the bones, the spaces in between the carpal bones, as well as the radiocarpal joint. On lateral view, we look at the alignments of the bones in relation to the distal radius and the metacarpal bones. This is the X-ray of the left wrist joint. Please take your time. You could pause this video and go through the names of all the bones included in this radiograph. Also try and remember and understand the alignment and relation of the bones with regards to the adjacent bones. Let us look at the radiograph of the right forearm. Let us pay attention to the radius, the ulnar, and the distal humerus. The radius has a styloid process, a radial tubercle, and a radial head. The radial head articulates with the distal humerus with the capitellum. The ulnar, on the other hand, has a ulnar styloid or styloid process, and it also has an olecranon process which articulates with the distal humerus with the trochlea. Earlier, we looked at the AP view of the right forearm. Now, we are looking at a lateral view of the right forearm. Let us look at the bones closely. This is the ulnar bone. Here you can see the olecranon process. This is the radius, and we can make out the radial neck and the radial head. These two bones articulate with the distal humerus. It is important to learn and understand the alignment of these bones in relation to each other. This will help us detect fractures as well as dislocations. Here we see the lateral view and the AP view of the right elbow joint. All the structures involved or that make up the right elbow joint appear much larger than the previous radiograph. This helps us detect subtle fractures and also joint effusions that may suggest fractures of the radial head or distal humerus. As mentioned earlier, this is the distal humerus, this is the proximal radius, and this is the proximal ulnar bone. Similar structures are shown in the AP view. Please take your time, pause this video, and familiarize yourself with these structures and try naming them and understanding their relation to each other. This is a radiograph of the left arm. Here we see the left humerus entirely. We see the proximal and the distal humerus in AP view as well as in lateral view. This helps us detect any fractures, especially in trauma patients. Here we have the radiograph of the left shoulder joint. Let us look at some of the pertinent anatomy. Here we have the left humeral head. It articulates with the left glenoid cavity. This is the scapula. This is the acromion. This is the clavicle bone, and this is the coracoid process. This is an excellent image of the radiological anatomy of the left shoulder joint. Feel free to pause this video and go through all the labeled structures. Pay attention especially to the glenohumeral joint and the acromioclavicular joint. Let us now proceed to the bones and joints of the lower limb. These are radiographs of the right foot in AP and oblique views. Just like the hand, there are numerous bones that make up the foot. It is important to know the names and the orientation of these bones on radiograph, which you will see in the subsequent slide. By now, I'm sure you are familiar with the bones that make up the foot. Let us look at the orientation of these bones on radiograph and also paying attention to the joints of the foot. This is the distal phalanx of the great toe, and this is the proximal phalanx of the great toe. This is the first, second, third, fourth, and fifth metatarsal bones. Pay close attention to the base of the fifth metatarsal bone, as it is a common site of injury. Here we have the three cuneiform bones, which are the intermediate, the medial, and lateral cuneiforms. This is the navicular bone, and this is the cuboid bone. This is the talus, and this is the calcaneum. And here we see the distal portion of the tibia and the distal portion of the fibula. Joints to keep in mind are the interphalangeal joints, the distal interphalangeal joint, and the proximal interphalangeal joint. The metatarsophalangeal joints of the first, second, third, and fourth and fifth toes. Please take your time to go through these joints as well as the bones and try to name them and see if you can do it without referring to the labeled diagram. Now we examine the ankle joint. Like any other joint, it is examined in two views. This is the AP view and this is the lateral view. Let us try and familiarize ourselves with the bones involved. Here we have the distal portion of the tibia, and this is the distal fibula. This is the talar dome. You notice that the articular surface of the talus is parallel to the articular surface of the distal tibia. This is the calcaneum and this is the talus. This is a radiograph of the leg, the left leg to be more precise. This is the entire X-ray of the tibia and the fibula in AP view. Now let us try and go through some of the anatomy of these two bones. So the tibia has a medial and lateral tibial condyle, and there's a shaft of the bone, and you have the medial malleolus, which originates from the tibia. Here you have the fibula head, the shaft of the fibula, and the distal portion of the fibula, also known as the lateral malleolus. Now let us look at some of the structures in lateral view. Here you have the patella, the femoral condyles, the tibia. This is the tibial tuberosity, and this is the fibula. Moving on, here we see X-rays of the left knee joint. As mentioned earlier, X-rays are always taken in two views. So here we have the AP view of the knee joint and the lateral view of the knee joint. We see the same structures we described earlier. However, since this radiograph is focused to the knee joint, we see the structures larger and with more accuracy. These are the femoral condyles. These are the tibial condyles. This is the fibula. And here we see the projection of the patella over the distal femur. On lateral view, we can appreciate the femoral condyles well, the lateral view of the patella, the lateral view of the tibia and the fibula. Now we move on to the X-ray of the right femur. This is an X-ray of the right femur in AP view. When examining any bone, a tip is to look at the outline and the cortex for any break in the cortex or for any fracture. So as mentioned earlier, this is the AP view and this is the lateral view of the femur. An ideal radiograph should include the entire bone that is being imaged, the entire femur, including the femoral head, femoral neck, the shaft of the femur, as well as the distal portion or the femoral condyles of the femur. This is an X-ray of the pelvis. It is useful in detecting dislocation of the hip joint or fractures of the femoral neck. Let us look at some pertinent anatomy. This is the acetabulum, where the femoral head lies. This is the femoral neck. And if you look closely, you will notice trabeculae within the femoral neck. These are all normal appearance of the femoral neck and the hip joints. We have now completed the bones of the upper and lower limbs. Now we shall move on to the vertebral column. These are X-rays of the cervical spine in AP view and in lateral view. We shall go through the anatomy in more detail in the subsequent slide. However, try and notice that the vertebral bodies are aligned in a straight line and their posterior elements are also aligned in a straight line. This is a lateral view radiograph of the cervical spine. You should see the C1 right up to the C7 vertebral bodies, as well as the T1 vertebral body if possible. Let's look at some anatomical structures. This is the anterior arch of Atlas. This is the dens of C2. This is the vertebral body of C2. This is the spinous process of C2. This is the facet joints, and the space in between the vertebral bodies are the intervertebral disc spaces. It is also important to note that there is a curvature to the cervical spine. This is a normal curvature and is known as the cervical lordosis. These are X-rays of the thoracic vertebrae in AP view and on lateral view. Just like the cervical vertebrae, the thoracic vertebrae are aligned one on top of the other. This is also the normal curvature of the thoracic spine. Now let us go through some anatomy. This is the C7 vertebral body and this is the T1 vertebral body. All the way down here we have the T12 vertebral body. If you look closely, this is the spinous process of the T12 vertebral body. You can also see the pedicles within each vertebral body, and on either side of the thoracic vertebral bodies you would see there are ribs. On the lateral view you can see the posterior elements and the spinous process of the thoracic spine. Take your time, pause this slide and go through all the anatomical structures until you are familiar with them. These are radiographs of the lumbar spine and the sacrum in AP view and on lateral views. This is the sacrum, this is the L5, L4, L3, L2 and L1 vertebral body. If you notice, this is the L1 vertebral body on AP view. You can make out the spinous process and the pedicles on either side. You would also notice there is absence of articulation of the lumbar vertebral bodies with the ribs, as you would see in the thoracic vertebrae, as shown here. These are the transverse process of the respective vertebral bodies. On the lateral view, you can appreciate the posterior elements and the spinous process of the lumbar spine. Pay close attention here and you can make out the sacroiliac joints. These are some of the references I've used in my lecture today. Feel free to explore further and look into these links for further information. We have now reached the end of our lecture. Thank you for your attention. I hope you have gained adequate knowledge from this lecture. Take your time and go through this lecture again, pausing as you need to go through the relevant anatomy. Take care and all the best.